So, primary sclerosing cholangitis in children is said to be very common, but we wanted to see how much common it is in IBD patients. So we decided to do a retrospective study looking at 30 years from UCSF, pediatric age group between 0 and 21, trying to understand the characteristics of all these patients. So very interestingly, we found that the gender was male preponderance with 63%, and whites were more common to have this at 85%. The most common IBD involved in PSC was ulcerative colitis at 71%. Very interestingly, we wanted to know what brings this patient in when they have PSC, and we found that 74% of them come in with an elevated transaminases, and very few of them come in with diarrhea. And interestingly, we said, what about ERCP? Just 12 patients underwent ERCP in a 30-year period, compared to histology where 27 patients underwent histology analysis. 5 of these patients eventually had a liver transplantation. Based on the histologic fibrosis, the most common was stage 3, leading to liver transplantation. Inflammatory bowel disease in adults has been very common in PSC patients. In adults, it's about 90% of PSC will have ulcerative colitis. In our data, we found that 71% of PSC patients will actually have ulcerative colitis, and the most common histologic finding was pancolitis, with the least common with the ileum, and this is because it's due to Crohn's disease. We looked at colectomy and wanted to know what happens to all these patients with ulcerative colitis, and out of them we found that 5 of them eventually will lead to colectomy, and out of the 3 of them also had liver transplantation. The median age of ulcerative colitis leading to colectomy was 5.5 years, compared to 3.8 years with liver transplantation. So interestingly, we know from other studies that there's no way you can have PSC without IBD. Shown on this diagram, most of our patients did have IBD, and interestingly, some of them had liver transplantation also leading to colectomy. In conclusion, we found that 13 to 16 years were the most common age group with UC and PSC, and the most common UC leading to colectomy was pancolitis. Most of these patients have periductal reaction, and very few of them had septal fibrosis. I know more studies is needed to look into PSC and UC. Thank you.